Okay, are you seeing the slide? Okay. Well,
yes, we see it.
Well, morning. I'm starting with the medical Sapiens, which is a software, it's a web software to making decision in healthcare, to make to make diagnosis support. Okay. I'll try to go to the next screen, to the next slide.
Okay. Thank you.
Here we go. Okay, this is the team. It's just five of us that we made this software with a long time. It took about 4 to 5 years to make this happen. What's the idea behind Medical Sapiens? Well, this starting as a response to collect the experience of great master of medicine, and then add the evidence-based medicine and create a system with cardinal measures that synthesize both sources. I mean, take the experience and take the knowledge, mix it, and make a big model in ISAHP. Well, next, these cardinal measures were used to obtain the weights of symptom and sign to build a profile disease. We will see later what I mean for profile disease. All of this was based in the ISAHP decision-making platform. How we do that? How we did this? Well, as Tom Sadi say, if you want to measure, pair compare. And we do that. Just by comparing diagnosis patterns versus patient profile. As you can see in this square down here, the question is, how much do they look alike? Are they topological compatible? Well, this is the question that you have to put on the table. But also this question produces another situation. You have to able to measure that kind of compatibility. It's a topological compatibility. Okay, so what means topological compatibility? What is order topology compatibility in real? For instance, we have here a list of disease from A to G with different kind of profiles. You can see these profiles, the red one, the green one, with different peaks. These peaks are made by the weights of the different criteria. So you have to build all of this knowledge about how the disease is presented. And next, you also have a patient that can, because have some problem. So you take the patient profiles and the software, you begin to compare every disease with the patient profiles. And the system can calculate the compatibility index. I mean the closeness between the disease with the patient. You have different disease, different values for the compatibility, and of course, which has the greatest value in compatibility means that you have a higher certainty that the patient presents that disease. In this case, for instance, the disease of G, that's irritable colon, have a compatibility of 97%, which is bigger than 90%, which is threshold for a minimum level of compatibility. Okay, one of the software have many features. Okay, but one of the we want to show here is that is replicable in different countries. I mean, it's not just for here, but you can put it in a, because it's a web system, you can put it in different zones in different countries, adaptable to other language, because we can make interface translation. The interface is a separate software from the part of calculation. The adaptable local language, you can take the local disease and present with symptom and signs. I mean, it's very easy to add disease of a specific geographic zone, because it's put inside of the system a disease is just like to put inside a patient. Okay. ¿Por qué perdimos la?
Le clic en el otro y nos metemos desde ahí.
Now we want to show the software itself. Just a second. I see. Okay. Now I leave you with Mario Sandoval, who is a doctor, medical doctor, to show you the software itself.
Hello, everybody. Good afternoon. I show you the software. CG. This is a web software. I present you is the web page. We have several patients. I'm prepared a patient for show you. Francisco Pella, 64 years old, male. He visited the doctor for muscle type pain. The software has 3 boxes: anamnesis, physical exam, and remote anamnesis. The first is the symptoms that the patient told us. Physical exam is the physician find in the patients. And finally, the remote anamnesis is the history, familiar and personal of the habits and surgery, hospitalization of the patients. In anamnesis, we have general symptoms and specific symptoms. In this case, I show you the muscle pain. This patient have a local pain in the thigh. I select single muscle and the profile of the temporal profile. Here start insidious, more than 6 weeks, and increase the pain. Save and back the software. And now I show you specific symptoms in the lower lines. In left thigh, the type of pain, the kind of pain is a neuropathic pain with paresthesia and dysesthesias. Location in the thigh, located in focus place, and the intensity is moderate. The temporal profile is insidious, was intermittent, some days with pain and some days without pain, with a circadian relation in the presence of the pain, with not irradiation radicular. Modifying factor is increased with physical activity and the position of the patients. Decrease the pain with rest, and the type factor is not traumatic. Well, I save them back, and with these only symptoms, I ask the system to calculate which is the priority of the sickness. Certainly. And the software response that is meralgia paresthetic in the left leg. This is a patient who visited several doctors, about 2 years visited many specialists, and at the end we put only symptoms in the software, and the software said it's meralgia. In this part of the software, we can do the differential diagnosis with each kind of sickness. For example, here we have the meralgia on the left, and the right is the episode of my patients. The patient have tell me some information, but I not complete. And now I complete that. I put this in duration is in subacute. And now I see what happened with the certainly of my patient.
It increased.
Increase 5% at least, and we close to the real diagnosis, only with symptoms in this case. That's all. It's the software Medical Sapiens that I like show you. If you have some question, please.
It's very good in the sense that with only symptoms we can make telemedicine. We don't need to have it's not necessary to have the patient in front of you.
It's better that if you do physical examination, but it's not possible in our reality because of the pandemic, but it's very good for approach to the diagnosis. Thank you.
Can I ask a question to Mr. Garuti?
Yes.
Hi, Mr. Garuti. Nice to meet you. I'm from Turkey. I think this medical Sapiens was a huge job. Congratulations for your work. My question is that do you have research about another software that does the same job with your software? Is this medical Sapiens is unique?
Yes, that it is true. It's unique.
Perfect idea. Congrats.
Thank you. Thank you very much.
Claudio, could I ask a quick question? You know, this is really great. I can see the progress in 5 years, and I follow this. But my question is, I can see that you use the compatibility index to compare the pattern of expected pattern of a disease with the pattern that the person has, right? But I don't see where a pairwise comparison would take place, and if they take place, when you assess, is there any part where there is a pairwise comparison of intensities or anything for symptoms?
Okay. When you build the different disease, you have to describe them, and that description is made with all a group of physicians, and that you use the pair comparison matrices.
Okay. Okay.
To obtain the weights of the different criteria.
Right. So you're not showing the next step, which is to see the compatibility between the expected pattern and the pattern that the patient has.
Right, that's because we have just 10 minutes.
Okay, yeah, okay. Thank you very much. Go ahead.
Thank you, Enrique.